Welcome to Talking Heads on USA Global TV, starring the one and only wonderful Dr. JACALYN. It's a prestigious place where world-class influencers and experts meet, and where you'll find the most trusted advisors and coaches for all things in life and business. Visit usaglobaltv.com to sign up for our newsletter, get the value you need, and be first in line to learn about events and giveaways and other valuable content. Connect with us. Email Dr. JACALYN at usaglobaltv.com to talk about how you can become part of USA Global TV. That's USA Global TV, where the doctor is always in.
Hello, everyone. Thank you so much for being here, whether you're watching or listening. This is USA Global TV and Radio. I'm Dr. JACALYN KERBECK. I'm the president, founder, and chief listening officer here at our network. Our show today is The Power of Etiquette and Manners. And my co-host, Mr. Philip Sykes, is on holiday and unable to join us. But we have a fabulous guest and an incredible topic today. This topic is so near and dear. I have a doctor's appointment coming up next week. It's been made for months. I'm literally dreading it. But the reason why I mention that is because we're going to be talking about etiquette and manners when it comes to the healthcare profession. So for all of you medical students out there and for all of you physicians, please do pay attention, because what's going to be shared today by our expert is super fantastic. Our expert is Dr. Shandana Sheikh, and she is the co-chairperson of Avencina Medical and Dental College and Avencina Hospital, a healthcare family-run business in Lahore City, Pakistan. Let's welcome her to the program. Hello, doctor. Nice to have you.
Hi, Dr. JACALYN. Thank you so much for having me on your show. It's a real pleasure to be here. Thank you so much.
Thank you so much, and I really appreciate you. I hope I said the name of the facility correctly. Did I?
Yes, you did.
Okay.
It's Avencina College. Thank you so much.
Thank you so much. So, doctor, you have an incredible background, and the work that you're doing, I feel like here, at least in the United States, it's cutting edge. I have never heard anyone talk about etiquette and manners when it comes to the healthcare profession. And yet so many times, like I just mentioned, I've got this doctor's appointment coming up. I'm really dreading it because we don't feel like we get treated the way that we should get treated. And yet at the same time, the physicians are overwhelmed. It's one patient after another. And at least here in the States, they've got all these goals and initiatives that they have to hit. So how is it that you decided to undertake this incredible, this amazing, huge topic that expands across the world?
So I'll tell you about my journey. So how I started off with the talking about etiquettes and the role of manners basically in healthcare. So my work, so what I do for my business is I look after admin, and I have a lot of interaction with students. So I look after student affairs and marketing as well as administration. And when I used to interact with students, so how the student body works is that everybody has a very different background, as with any other college or university. And when I interacted with students, I realized that since they have very different upbringing, they come from different education systems and they come from different backgrounds. They all have different grooming. But when they come into med school or when they come into dental school, they all are the same because they're getting the same level of education. And foremost, their job is to save human lives, which is such a huge responsibility that you need to have your A game at all times. And then, like slowly, when I used to interact with them, I thought that, okay, they're good with their academic skills because that's what they learn. Their academic knowledge is at par with what should be taught to them. Then they also have exposure to clinical skills. But then there's something lacking, and that something was professionalism. That something was grooming. That something was how to communicate with the patient, leave aside the patient, how to communicate with the staff, how to communicate with your fellow doctors. And I realized that, if that particular aspect of their personality is groomed, probably they would be an all-rounder physician or a doctor. And then I started exploring more that, okay, what can we do in order to shape those skills of a student while he's still a student? Because one thing is that when you go into the medical profession and you complete your studies, you go into your foundation year, you start your practice, or you start your rotation with the patients. That's the first time you're interacting with the patient. So rather than you being taught at that time, you have no knowledge. If you don't have any grooming and if you don't know how to talk to the patient, it would just be a hit and trial thing. So I thought that, there should be some training mechanism which teaches them how to introduce themselves as doctors to the patient, how to say, hello, I'm Dr. Shandana. I will be your doctor for today. Can I know your name, please? So establishing that bond, which is just not a professional bond, just not the case that I'm a doctor, you're a patient, and we're just going to have a formal talk. Establishing a comfort level with the patient and making sure that you listen to the patient and the patient is heard. And when the patient goes back, he wants to come back to you. Now, there are many doctors. So, for example, I live in Pakistan. And over here, if I talk about our med school, we have 950 students each year. So each year for 5 batches, we have 950 students. And most of them are girls. And I'm sure most of them will get to some point where they will be practicing physicians or doctors or their own specialists. But a good doctor is a doctor where the patient remembers him and the patient says that, yes, he treated me really well. He heard me, he listened to me, he did all the things that I wanted him to do, starting from asking me about my problem or the issue that I'm having, diagnosing it properly, listening to my issues, and then making me believe that there is going to be a solution to it. Nowadays, what we feel is that because there are many people who are doctors, but they spend little time with the patient, and it's more of a commercial activity. And why is this a commercial activity? Because we spend less time communicating with the patient. If I go to the doctor, he would just listen to me and he would say, okay, this problem, okay, take this medicine and go. When we establish a bond with the patient, we set ourselves apart. And that's where etiquettes come in. So there's no wow factor in it. It's just how you reflect your personality, how well you are groomed to talk to the other patient. And I believe that in the medical profession, this is so important because another human life is in your hands. And the way you talk to someone and the way you make them feel will really either make their day um, or probably break their day, because not everyone comes with a very minor health issue. Some people have major health issues. How do we communicate about them? How do we communicate about end of life? What are patient bedside manners? There is so much that a student, being a med school student, should learn about, that probably there could be an entire research project on it. So that's where my interest developed, and that's where I started researching, okay, what do I need to do? How can I develop those skills, and how can I push the students to develop that aspect of their personality? And then I came across British School of Excellence and the phenomenal amount of work that they've done and they're still doing across industries. And I realized that, etiquettes is not just pertaining to just one industry. It's such a universal concept that it encompasses, and it's like spread over all different industries, whether you talk about hospitality, whether you talk about healthcare, whether you talk about the food industry. It's a universal concept. And whether you talk about everyday interactions. So, for example, coming back to the healthcare industry, it's not just important that you establish good etiquettes or good manners when you're communicating with the patient. What about the patient's attendants? What about your own staff? What about a fellow colleague? So developing empathy is so important, but how will you develop? You might have a lot of empathy in you, but what if you're not able to communicate that to the patient or the patient's attendant? So there's so much that you can learn with good etiquettes and manners, and particularly medical etiquettes, that um, I believe, is immensely important to groom good, professional, and competent doctors, not just in Pakistan, but across the globe.
Absolutely. And I honor you for the work that you're doing. I have so many questions. Let me think where I want to start. So, how are you and this process being received by the medical students? Are they excited, or are they like, oh, another thing we have to do? Or is it kind of like, wow, they're putting on fresh glasses and saying, this is exciting?
That's a very interesting question, Dr. Jacqueline, and I'm really excited to answer it as well. So, what happens is that med school curriculum and the education is so rigorous. It is so rigorous that probably um, med school is a time where you get little time to do anything else, because you're so busy all the time. Like, you have so much to cover that literally either you would not want to do anything in your spare time, or definitely not want to do another training or um, a workshop or any other aspect that has to do anything with academic activity. So that was really a challenge. And I thought to myself, how am I going to actually introduce this? Because the students will perceive this as, oh my God, not another academic activity. So, but I thought, and that I believe that, when you offer something which you want them to take on as a life skill, you have to offer it differently as compared to their normal curriculum. And that's what I did. So normally what they do is that they have lectures and they have classes every day. And obviously, because that's part of their curriculum. And I did not want to make this part of their curriculum. I wanted this to be on ad hoc basis. So, for example, 3 sessions on social etiquettes and medical etiquettes in a year. And I wanted to have these in an environment which is very separate to where they have their normal lectures. So I prepared two. So what we have done in our med school is that we prepared 2 training rooms, and which have a completely different ambience as compared to their normal lecture halls where they have regular lectures. And then what I've done is that I want to have this training in a very small group. So normally the class strength is 150. In every lecture, in every class, there are 150 students, because that's how the batches are. And they have like first year students 150, second year, third year, fourth year, and final year. But I didn't want to do this as a master class for 150 students, because I felt that there is going to be no point in doing that, because I wanted to have that one-on-one interaction. During the process, I wanted to learn about them. And during the process, I wanted them to take away everything that I had knowledge about etiquettes to for them to learn and for them to take away. So what I decided to do was I decided to have this training in small groups of not more than 18 to 20 students, and at a time where they would be really looking forward to this training. And obviously, I do know that initially the perception would be, oh my God, what are we going to learn about? But I happen to do focus groups and have a few discussions with the students in every class. And to my surprise, or to my, I was so happy to know that they're all very, they all look forward to developing that side. I don't know whether they want to, because I think it makes them more competent. So, for example, I asked them that would you be interested in a workshop which teaches you communication skills and presentation skills, and which teaches you how to attend conferences, how to network in a conference? And they just looked at me and they said that, where are we going to do that? And I said, I'm planning to arrange some trainings, and would you be interested? And they were like, if that's the case, everybody would be interested. So I think it's about the exposure, because I think med school, again, I would like to reiterate that it's a time where there's so much rigorous study that, and most med schools, I'd also like to admit to it, that they don't offer such complementary trainings which actually support the academic and the clinical skills that medical students are developing during their course of study. So right now the students are excited, but we are still in the process of marketing this. We want to market it on the basis of the fact that it is a requirement of their curriculum. So in Pakistan, how it works is that, and I'm sure it's the same way abroad, that medical schools, both private and public, are governed by a higher authority. Just like universities are governed by Higher Education Commission, in Pakistan, medical schools are governed by an authority called Pakistan Medical and Dental Council, or Pakistan Medical Commission. And they introduce standards, or they introduce proformas which all medical schools have to abide by. And in that proforma, they have particularly mentioned that any medical student in Pakistan has to develop into an all-rounder 7-star doctor. And what are the characteristics of that 7-star doctor? They need to have academic skills and communication skills, and that. Okay, academic and clinical skills are two aspects of it, but the third aspect is professionalism. So I actually, when I started marketing this, I actually took that bit and said, listen, you won't be competitive in the market abroad. Because
It looks like we may have lost the doctor for the moment. So I think this is a great time to take a break, and we'll be back hopefully with more information. This is a really fascinating topic. I hope you're finding it of interest as I am. All right, thank you. We'll be right back.
Kapayapaan, kapayapaan, kapayapaan.
Diane Floyd Bame's A Song of Peace tells the story of a young lad named Tommy whose fervent wish for peace on earth touches the hearts of his friends and family, spreads to his community, and eventually unites the whole world around making his dream of peace a reality for everyone. Sit down with the children in your life and share Tommy's amazing story of love and hope. Sing your own song of peace and invite the children to join you. Tommy's tale is more than just a story. It's a movement, and everyone's warmly welcome to take part.
Kapayapaan, 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 kapayapaan.
You'll find A Song of Peace, along with many other wonderful learning and enriching opportunities for children of all ages, at dianefloydbame.com.
The session that we had with BCAT was really entertaining and enlightening. We were able to put together some very specific steps that we as individuals can take, and it was really fun to all come together and see sort of where we're going as a team and how we can all get there together.
We had a tremendous experience with the BCAT partners. One of the challenges that we have as an organization is to make sure that we have the right people in the right chairs doing the right thing. To do that well, you have to have synergy. You can try to dream up ways to make sure that your group does that, or you can rely on experts. We would recommend BCAT partners to anybody who's looking to take their organization to the next level.
Welcome back, and thank you for staying with us. This is very exciting topic, the power of etiquette and manners in the healthcare industry. Joining us once again with more incredible information is Dr. Shandana Sheikh. Welcome back. Oh, I can see she's backstage, but now I can't see her. Oh. Well, she looks like she's frozen again, so I'm going to put her backstage. One of the questions that I have, and maybe you have some questions yourself, when you think about someone who is in the medical community, or if you think of someone who is a therapist, all day long they're meeting with people from the public who are sharing things that they're upset about, things that are wrong with them, questions that they may have. And my question that I wonder is, once you have the training for how to deal with people listening, communicating, and showing up in a certain professional way, who do you then have to talk to after you've been listening all day? That's what I'd like to know, because if you think about it, the doctors need someone to speak to as well, because otherwise they can carry all of what they've heard all day back home or into other relationships they have. So I'm really interested to find out if part of this process that doctor is talking about today also includes the education on the fact that doctors can turn to other people to get help, to share what it is that they're experiencing by working with the public. So if you have any questions, please do let me know. One other thing I want to share as we wait for Doctor to come back is that she also has a connection with Dr. Sadia, who is from Pakistan, who is also involved with the power of etiquette and manners with the British School of Excellence, Pakistan. So we've interviewed her before. You can find that over on our playlist, USA Global TV and Radio. Just go over to the power of etiquette and manners. So one thing that I'm taking away from today's show, and I've taken away from a number of these shows, is at the core, at the crux of all relationships is the ability to listen at an elevated level. And if you think about when you go to a doctor or you go to a therapist or you go to a professional person and you were to rate that person on their listening skills, how well would you say they do? And how does that impact your interest in going to see them again? Now, in some situations, let's say you have a certain insurance plan, at least here in the United States, and you can only go see certain doctors. You have to get a referral, or the doctor's booked for months in advance. So sometimes I know that I felt sort of trapped that I have to go see certain people. But if that's not the case, how open are you to going back to see that person based on how well they were listening to you? Looks like Doctor is back in the house. Oh, she just disappeared again. Okay, my apologies. I guess the Wi-Fi there isn't too strong today. But as we just continue thinking about these things, what I'd like for you to think about when it comes to the power of etiquette and manners in your own role in your life, whatever it is that you do, whether you're a stay-at-home person or you go to an office or you're working from home, how are you showing up as a listener? Are you burnt out? Are you overwhelmed? Are you taking your feelings, your emotions, and the challenges that you face? Are you taking them out on the people whom you serve or the people whom you love? That's really important. I know I've done it myself, and I'll just be honest with you. I have ulcerative colitis. I've had it for 30 years. I'm in an active flare. I'm in a lot of pain. Even right now, as I speak to you, I'm gripping onto this chair in front of me. And so my point is, I don't think I'm always as nice as I could be to my mother because I'm in a lot of pain and she's right there. So who do I give it to? So the point is, how are we showing up and what can we do so that we look at our own behavior and our own listening skills? I think the doctor's with us. I'm crossing my fingers. Let's see if she is. Dr. Shandana, are you there? All right, she's not there. So it looks like we're going to be challenged to bring her back today. But I just want you to think about what I'm sharing today. We always have reasons of why we act the way that we act, but is that actually fair to the other person? Are we being true? Are we being professional? Are we being kind? And if we're not having a great day, maybe we just start off with that. Hey, I'm here for you. I really am. I just want to let you know that this is kind of a tough day for me, but it's not about me. It's about you. But I just want to let you know that I'm here to listen to you. But it might be better if we were to have a chat in an hour or tomorrow. Now, if you're a healthcare professional or someone else, you can't do that because you got somebody right in front of you. I'm crossing my fingers again. Doctor, are you with us? Yes. Hallelujah. Thank you, doctor. Welcome back.
Thank you so much, Dr. JACALYN. And I'm so sorry about the connection. It keeps breaking up. I don't know what's wrong today.
It's okay. It's not your fault. Don't worry about it. I do have a question for you that I just posed to our audience. And what I'm wondering is, in this training, in this packaging, will you be also offering information that after doctors, medical students, they're listening to people complain all day. People are afraid, they're concerned about their health. And at the end of the day, that professional needs to have someone to speak to as well, because if not, they take all of what they've heard home to their spouse or significant other or into the office. What are your thoughts about how important it is for that healthcare professional to have someone to speak with?
Absolutely, Dr. JACALYN. I think that's absolutely that's also a skill to develop, and even not just when they're practicing doctors, but even while they're studying as med school students, because we see so many students, and everybody has a very different way of taking on pressure. So, for example, we see so many students who can't cope up with the rigor of the medical studies, and they have a lot of anxiety. Some of them, they go into depression, and some of them, they stop studying because they feel as if, they have this feeling that we can't do it, and we are not worth this profession. And there's so much that people go through while being on this journey. And definitely, you're absolutely right that, when after a long day, when you're dealing with so many patients, and when you're listening to them, when you're being a good communicator, when you're being a good listener, but what about your own emotional well-being? You also need to actually take that load off your shoulders and discuss this with someone, and share your day with someone. And it's most important. And I think for example, I always read a story to my son that, worries, when they're shared or when they're communicated to somebody else, they are actually reduced. And it's so important to talk to people about what you've been through throughout the day. What are you thinking? What do you feel about a certain patient? What do you feel? Is he going to make it? Is he not going to make it? And in different specialities. So, for example, if you're going to save a life, if you're going to save a mother's life, but you weren't able to save a baby's life, or if you were full of joy because you were able to have a very complicated operation or a surgery, and you were able to save both lives. So it's so important to talk to someone at the end of the day, and just to be able to take those feelings out, and be ready for the next day.
Thank you so much. I'm so glad to hear that you're including that, because that really is important. And I love this entire holistic approach that you've taken. So when you look at the implementation and the rollout, is this something that we could all experience regardless of where we are in the world? So in other words, is this sort of this process that you've put out, is it something that you could also roll out across the world if you had the right partners?
Absolutely. So when I was going into this, I actually thought that, okay, this is something so important, because this does not only teach them a life skill while being on their medical journey, but this is something that will stay on with them and set them apart from other physicians, other doctors, and help them build on their brand. Because we always want to go to doctors who have one or more skills which are different than another doctor. Because academic knowledge and academic training and clinical training probably will be the same for two doctors, but the way that you approach the patient, the way that you interact, is what sets you apart. And that is all about etiquettes and developing good communication, XYZ. So yes, my plan is that, I don't know about the world. That's actually going to be a long term, probably a long-term strategy that I'll be tapping into, developing international partnerships. But definitely, as when we talk about Pakistan itself, there are more than probably 70 or 80 medical and dental colleges over here, medical and dental universities over here, and just in Lahore, probably there are more than 20 or 30. So I definitely plan to make this as an approved training curriculum for all med schools, because this, I believe, is the hard skills that all medical students must have. And I believe that when you teach them young, so for example, if I want to teach a physician who is already practicing, who has been practicing since years, who has established his way of doing things, whether those are the protocols of the surgery, or whether those are the protocols of introducing or getting introduced to a patient, he has established those. So it will be very difficult for him to change, and it would be very difficult for me to give him this training and to change him. I wouldn't expect this from a 60-year-old at this stage. But I can definitely say that when you teach them in the first year, and when you continuously teach them and refresh them with these etiquettes, it goes a long way. It actually gets ingrained in them as part of their curriculum, and it goes a long way. And that's exactly, so what we are doing is that we're investing in these students who are going to be future doctors. But at the same time, we are investing in them so that they save a life the right way. And they also, at the end of the day, they make or break someone else's day, and they know what the other person is feeling, and they communicate in a way where they're conscious of the fact that how do they make someone feel at the end of the day.
I just think this is so brilliant and so needed and on point. So thank you again and congratulations. A follow-up question I have with you is, so I'll just give my experience. I go to see my physician. I have to check in at the desk, right? Here's a clipboard, fill this out, or here's the iPad. And then someone comes to get me and they do my vitals, and then they put me in the room. And then sometimes I have to go into the next room. And then finally the doctor comes in, but yet there's no information given like, hi, I know your appointment was at 9 o'clock today. I just want to let you know, doctor is running behind, and he'll get to you as soon as possible. I estimate you'll be sitting in this room for probably 45 minutes. So if you want to look at your phone, please don't talk to anyone, but some kind of expectation, instead of you're just sitting in this room, there's nothing to do, and you keep waiting for the doorknob to turn or someone to knock on the door. So I feel like the whole office in the medical profession needs to be educated on etiquette and manners as well. What are your thoughts, doctor?
Absolutely. I couldn't agree more. And a recent incident that happened with a friend of mine, and she was so furious about it. So she went for a very small procedure, which is an ultrasound. So she had to get an ultrasound done. And she went to a hospital, and she came back and she was ranting so much about it. And she said that when you go in for an ultrasound, obviously you need to have a full bladder. And I was waiting, and the doctor just came out after checking the patient who was already in and left. And I kept on waiting because other patients were also waiting. And then she said that, 15 minutes had passed, no clue. I asked the nurse, she was busy doing something else. I asked the receptionist, busy doing something else. Oh, the doctor will come back, please wait. She said 45 minutes later, the doctor came back. And I was imagining that what would have gone through in those 45 minutes, because it gets so uncomfortable, you sitting with a full bladder and just nobody giving you that information, that whether the doctor will be there, whether the doctor won't be there. So you're absolutely right that, it takes a village to build an etiquette community. It's just not the responsibility of the physician or the doctor. The physician is working with the nurse, and the nurse has the first point of contact. Even before that, the guard who opens the door for the patient or brings in the wheelchair is involved. So at every step, you have to teach them how to deal with the patient, because the patient already has such a huge amount of stress and anxiety and is worried already about his health, that you don't want to add on to those anxieties and stress. So it's so important for you to calm down the patient. And I also believe that, the training should be done, but at different levels for all of these people. So for the nurses, it's more important for them to communicate and how to communicate. And I was thinking that, the training becomes different, and it's altogether a different job. For example, when the nurse is going to take blood pressure for a patient, imagine there are two different situations where the nurse just grabs the arm, puts the cuff, takes the blood pressure, goes away, as compared to if the nurse welcomes the patient, introduces herself, asks the patient about him or her, and then keeps on talking to the patient so that the patient doesn't get stressed. Okay, what is going to be my blood pressure? And imagine a more invasive procedure where you need to draw out a sample of blood. Let's say you need to have a blood test, you're going in for a blood test, somebody comes, draws the blood, goes away, as compared to when somebody is talking to you throughout and ensuring that you don't focus on what is happening here, but you focus on something else. So, like, developing that rapport, developing that communication with the patient. So that is so important. And I believe that, these skills, they're even more critical for any doctor or physician to have as compared to their core academic knowledge. That's a given. Everybody's going to get that. But again, what will set you apart is how you deal with people on ground.
Absolutely. It's to your point, it's the village, it's a community, it's the entire shared experience that that patient walks away with. Another question I have for you, based on my background, when I was in corporate till 2020, I sold loyalty programs. So do this, earn this. So I just wondered, is there any opportunity? I don't know how it is in the medical industry, but is there any opportunity for physicians and for team members who go through the training to actually have a certificate that could be on their wall with their medical degrees, saying, hey, I am trained in how to deal with etiquette and manners? Because I think if I saw that on somebody's wall, I'd be like, wow, this is a game changer. I haven't seen this before. What do you think?
I think definitely, and that's one reason why I wanted to associate myself with a very credible institution, which is the British School of Excellence, because it's very easy for somebody to get trained and then pass on that training to somebody else. But then what you've just said is that when you walk into somebody's door and when you see all those degrees and one degree or certificate says that, oh, this doctor is trained in medical etiquettes and ethics and manners, automatically you develop that sense of credibility for that doctor. So I believe it's so important. And yes, we are going to. So what we have done is that we have developed one module. So how the MBBS program, the medical program in Pakistan works is that it is for 5 years. And they have different subjects in each of the years. So what we did was that we developed 5-year modules for all different 5 years. So in the first year, the students will be studying or will be trained in social etiquettes and medical etiquettes. In the second year, we'll be moving on to care standards. We'll be in the third year, probably we'll be talking about ethics and diversity and inclusivity, and so on and so forth. And when we combine these in CPD accredited, just from the British School of Excellence, but also they will be able to earn CPD credit hours, which is a reflection of them investing in their career. And normally people who go into the practice world, they start focusing on and they start talking about continuous professional development or continuous medical development. But here, the edge that we are giving our students who will be future doctors is that from a very young age, I was motivated to set myself apart and be competent and be able to present my A game. So this is what I did. So even before they graduate, they will be having a set number of continuous professional development CPD hours on their CV.
That is fantastic. Thank you for sharing that with us. And doctor, I'm wondering, for individuals who are watching this, who are in Pakistan or they're listening at a later time, is there an opportunity to have them reach out to you directly and say, we'd like to have that happen here at our organization or at our university or our school? How does that whole process work? Is it you reaching out to them, or they can also, like, a push-pull process?
So at the moment, because we are just starting off with this, so at the moment the point of contact will be me, but then systems and sustainable systems only work when you have an entire team working on for you. So we are in the process of developing those teams, and we are in the process of expanding. By expanding, I don't mean that I would be tapping into all other medical colleges. By expanding, I mean that I want to take this word and spread it throughout the medical college, throughout the nursing college, and to every other medical student who would want to reach out to me and just ask me, what is this about? How can I benefit from this? And even if I have to give this skill to a student for his benefit, for him to improve his practice, I would love to. Because the point here is not to just have a business. The point here is to help people who are saving human lives and to make them become the best version of themselves, especially when they have another human life in their hands. So that's the motivation that I have.
Brilliant. I love that. And one thing I just want to add is when I've interviewed physicians in the past here in the States, what I've heard over and over again is that they're really good at helping people, but they're not good business people. They're not good at running the office and doing the books and understanding the whole thing. They're good at, hey, I've got a patient. I'm here to serve this patient. So I also feel like it would be a great opportunity for you to get involved with the management teams, the management companies that work with the healthcare professionals and the doctors, because once again, it's all about ratings. It's all about word of mouth, that I went to this office and I was treated a certain way. And I really see that as being a competitive advantage. I hate to talk about it like in competition, but it really is. You're competing for patients. You're competing for reputation, for word of mouth. And again, this is a game changer, what you've created. That's what we call the pregnant pause. Doctor, are you still with us? All right. I think we have lost her. Oh, she's back. Yes, you're there. There you are.
Absolutely.
Yes.
Dr. JACALYN, I think that's absolutely, Dr. JACALYN. I believe that, there are big setups and then there are small setups. And then there are people who are working single-handedly. So, for example, if I talk about dentists, they normally don't have a team working up for them. Probably the only service provider or the only person who gives you the service is the dentist himself. And he can do everything else as well. So he can greet you, he can make you sit, he can treat you, and then he can fill up the prescription and he can charge you, and then he can let you go, right? Because it's a small setup. On the other hand, when we move into a hospital setting, every single person that you have an encounter with, they matter. So I believe that what you've just said, that at every scale, whether you talk about healthcare professionals or whether you talk about CEOs, whether you talk about management teams, it's so important to train them. People who are not even doctors. So, for example, if I've talked about nurses, I've talked about doctors and physicians, no matter at what level of service they are at. But then there are the other people working in healthcare organizations, admin staff. What about HR staff who actually recruits people? They probably are the first ones to tell them that, okay, this is our philosophy. So we talk about etiquettes and medical etiquettes, and we want each and every person working in the organization to reflect those etiquettes. So I think, again, it's a village that takes for the organization to have this image that really this organization has upscaled itself on etiquettes and grooming, and they have this motivation to reflect this particular skill in every procedure, in every practice that they're offering. So that's really important. But that happens over time. Obviously, it takes a long time for people, because nobody likes change. I've seen that, whenever you want people to change, there's always hesitation. But obviously, you can't impose a certain thing on them, but you need to reiterate. You need to actually again and again expose them to that particular change and tell them what value there is if they adopt that change. So that's really important.
I agree with you. We learn new things, but then when we're not actively using them, we tend to fall back. I teach people how to listen at an elevated level. They take the course, but then I see as a few months go by, they're kind of slipping into some of those behavior patterns because they're not actively working on it. So I really applaud you for everything that you're doing. I can actually see as an extension of all the things we've spoken about, insurance companies and call centers needing to be trained on this as well, because how many times do we go in for a procedure, blood test, a treatment, and we get a bill and we shouldn't be getting the bill. The bill should be paid by the insurance company, or the bill's wrong. Then we pick up the phone and we get the call center agent who all day long is listening to people complain. So I think they need the training as well. So I think what you're doing is absolutely fantastic. And I hope as many people as possible get involved to help support this initiative that you have. We do have a few comments. Let's take a look. From Arshana, congratulations. Also from Arshana, etiquette are important for personality enhancement. And also from Arshana, healthy bond between doctor and patient is key to quick recovery. And also a new comment, I hope I'm saying your name right, Enkelada. What a great vision. As a midwife and as an etiquette trainer and coach, I'm impressed and congratulate you, Dr. Shandana. Wow, very nice. That's really lovely. Thank you.
Thank you so much. Thank you so much.
So, Doctor, as we close out the program, I really hope that you'll come back and share updates about how this implementation and rollout is going, and anything that we can do to help you spread the word and communicate what it is you're doing, we're happy to do. So I'm going to spotlight you again, and any last words, messages you'd like to leave with our audience, as well as how can people reach you and who should contact you. Okay, well, I'm going to give the information for you to contact Dr. Shandana Sheikh. And you can contact her via her email address, which is here on the screen. But if you're on a radio station listening or on a podcast platform listening, here is her email address. It is SHEIKH.SHANDANA@gmail.com. You can telephone her directly through WhatsApp, and her phone number is 923-458-444-812. And I would imagine if you can't do it yet, you will be able to do it soon. You can go over to the British School of Excellence.com, and I'm sure there will be an offshoot for a website for Dr. Shandana. So thank you so much, everyone, for being here. I hope you found this as interesting as I have. And once again, we apologize for the Wi-Fi connection there. We can't help what happens with the Wi-Fi. Dr. Shandana is a wonderful person. I've met with her one other time here on the platform, and please do reach out, because what she is doing can change the entire face of healthcare across this world and how we feel as patients. And it all starts with one person, and that is Dr. Shandana Sheikh. Thanks again. Our next show is coming up. It is Talking Heads, and our expert presenter today is the lovely Madeline Chan, who'll be joining us from just outside London. Thank you again. We'll see you later. Bye.